The FDA commissioner sending a clear message on masks after Congressman Louie Gohmert suggested that he got the coronavirus from wearing one.
We don't have any medical evidence that that's the case. When I heard the clip with Representative Gohmert, and I've heard from family and friends, there's lots of people who have questions about the masks. What our data show is that people should wear masks, particularly when they can't socially distance, and they should follow their local ordinances with respect to masks. That's something that you're right, we've been talking about for weeks and months, and I think should be continue the message that the American people hear.
NBC News medical correspondent Dr. Torres joins me now. Dr. John, the FDA commissioner said it there. The data shows that people should wear masks. Is there any data showing that the virus can get inside your mask?
And Allison, I agree with what Dr. Hahn said, that hands down the studies are showing that masks protect you from getting the virus. And if you look at after the representative said his statement about getting it possibly from his mask, I went online, looked at a lot of images and videos of him over the last few days, last few weeks, and everything I saw, either he wasn't wearing a mask or he was wearing a bandana type mask, which we have found out doesn't work as other masks. On top of that, he also says that he touches his face many, many times when he has a mask on, which is one of the big warnings we give people. Don't touch your face to adjust your mask until you wash your hands. You have to be very careful with that. But as far as the data, theoretically, you could get the virus in the mask from somebody else if you shared masks. And so if you shared a mask, got it from somebody else, put it on, then you could get the virus that way. But as far as wearing the mask every day on a regular pattern, the regular way we talk to people about wearing them, it's going to protect you, and more importantly, going to protect others from getting the virus from you. The best thing is for both people to wear a mask, stay that social distancing. That's the best tool we have and the best protection you have. But the frustrating thing is somebody says something like this, it gets out in the media, it gets out in the news and on the different social media platforms, and we have to constantly battle this misinformation. And this is definitely misinformation, Allison.
All right, we got a new slogan now, Dr. John. Wear a mask, don't share a mask. That's going to be our new thing going forward, just to remind people what they should be doing. All right, that's our new thing. I have a back-to-school question for you. It's from a viewer who is also a teacher. She wants to know, should she get a UV light to sanitize her classroom? Is that something that could be helpful?
The bottom line is no, you don't want to get the UV light for one particular reason. Okay. So UV works well against coronavirus in a very specific way. If you look at UV, there are three different main components, UVA, UVB, and UVC. Those UV lights you get are typically the ones that are okay to use around humans, UVA and UVB. Those don't kill coronavirus all that well. The one that does kill it is the spectrum UVC. Now that, though, can also cause problems for humans, and that's why it's not used around people. When the sun shines light through our atmosphere, the ozone actually filters out the C portion of it, leaves the A and B to come through, and that's why we're not having so many issues with skin cancers and things, even more so than we're having now. That UVC can be lethal. You have to be very careful. That's the one that can kill coronavirus. Since you don't want to use that in the classroom, the other type of UV lights really aren't going to do that much good. And so the best thing to do is just to make sure you hand clean, kind of like Vicki was talking about, all the surfaces that are out there, because that's where it's going to land on, and making sure that people wash their hands as well. That's going to be the biggest things you can do.
All right, so no UV light for the classroom. Dr. John, exactly. A new study out today from the Journal of the American Medical Association shows that children with COVID-19 carry similar levels of the virus as adults. How does that impact the debate that we're having right now about opening schools?
And basically, it opens up the debate a little bit more, and it reemphasizes the fact that we need to be very careful when we send kids back to school. Every expert I've talked to, I myself agree with them. It's important to get kids back to school, with the caveat that getting them back to school safely is the big priority here. And one thing we found out from this study is that children tend to have as much virus in their nose as adults or even older kids. That is important because that means they could then spread it. But other studies have shown that kids 10 and under don't spread it as often as adults, and we think the reason that might be happening is simply because of their size. Number one, their lungs are smaller, so they're not expelling as much of the respiration, as many of the virus particles out there as adults or older kids. Number two, they're also shorter, so if you think about it, when a kid comes up to hug you, head's usually around your stomach region instead of up at your shoulders, so that virus tends to stay lower. But the bottom line here is what these studies are showing us is that, yes, kids can get coronavirus, and yes, kids can spread coronavirus, and even though we don't think they can get it or spread it as much much as adults, they still can do that. So we need to take the precautions before going back to school. And that means social distancing, wearing masks, hand washing, small groups like we've talked about, having pods so students stay in the same pods. On top of that, study came out also looking at ventilation systems in school. That's going to be important for schools to look at, and not necessarily rebuilding their whole school, but just making sure that the teachers in an area where the vent is blowing on the teacher, studies have shown that there's less particles floating around a room in that point. But these things, we can, with these things in place, we can get kids back to school safely, but we need to make sure we do that and get them back to school safely, because that's the bottom line to all this, Allison.
Oh, Dr. John, so much still for parents and educators to consider when we're thinking about going back to school. Thanks so much.
You bet.
A new COVID test can detect traces of the virus on common surfaces. The maker of that test say that you can get results within 48 hours. NBC News investigative and consumer correspondent Vicky Nguyen got an exclusive look at how it works.
Going up.
From handrails to elevator buttons, indoors and out. Could the coronavirus be here? This new test lets non-scientists like us find out whether anyone with COVID-19 has touched or breathed on the spaces we're in. It's made by San Francisco-based company PHYLAGEN, which gave us swabs to collect samples.
And we're trying it out for the first time. We have exclusive access to show you what the PHYLAGEN surface test is and how it works. You take a swab, dip it in the solution, and basically swab any surface that you want to test. We're doing this playground steering wheel. Just snap the top of the swab off in the sample tube, and you're done.
I swabbed all over New York City, in busy public spaces like the subway, coffee shops, and the grocery store.
All right, we're going to see what's on this cart handle.
The seatbelts, pin pad, and door handles in a taxi.
Taxi door handle.
And inside an Uber.
Not pretty, but we got to check.
Even inside a public restroom.
Another good spot, the elevator.
And what about these high-touch items at a restaurant? I wasn't alone. We enlisted NBC News producers from coast to coast, swabbing surfaces in 5 states, including hotspots California and Florida. 48 hours after shipping our samples to the lab, we got the results. All our swabs from Pennsylvania and New Jersey came back negative for coronavirus. No traces of the virus on the train, at the drugstore, or on the mail we swabbed. Not even the chair in the pharmacy waiting area. No positives in California either, where the producer swabbed a gas pump, bus seat handle, and this elevator button in an office building. But in New York, 2 positive hits. This grocery cart handle came back positive for SARS-CoV-2, the virus that causes COVID-19. And this self-serve bread bin, also positive. But the worst was COVID-19 hotspot Florida. Nearly 20% of our samples from Miami positive.
It's this inside elevator.
Overall, 6% of the samples that we took indoors came back positive, which is within the 5 to 20% positive rate predicted by the company. We shared our results with epidemiologist Dr. Tista Ghosh.
Is it reassuring for the public to know that maybe coronavirus isn't in all the places that they thought it might be?
Absolutely. It's reassuring to know that some of our prevention measures are working and that we're not seeing coronavirus in places like the mail or on certain public restrooms. While I'm definitely surprised by that, I think that's good news.
What are the limitations of a positive result?
Well, the limitations are that you really don't know how much of the virus is there, and you don't know if it's dead or alive. So you don't know if it can actually infect somebody or not.
PHYLAGEN co-founder and indoor microbiology expert Jessica Green says the tests are useful for businesses to monitor indoor exposure to COVID-19.
The real power lies knowing whether or not you have infected people that are asymptomatic, that are shedding the virus in closed indoor spaces.
Like a school or a nursing home?
Yes, this type of test could be used in schools, in nursing homes, hotels, restaurants.
She says if you regularly swab a school or an office and see a sudden spike in positives, it can mean people there are infected, even if they're not showing symptoms.
And that's really valuable information if you want to curb the spread of the pandemic.
Vicki joins me live now. And first of all, Vicki, I just have to say props to you. I just watched you walk into every place in New York City that I am afraid to go back to. The bathroom, the subway, you are so brave. Thank you for doing that. Could you talk to us a little bit about the results? Were there things there or things that you found that surprised you?
Yeah, definitely. And I think this is reassuring. I'm glad to hear that you're saying these are places that you avoided. But look, we were wearing masks. We don't normally wear gloves. I don't when I'm out in public, but we wore gloves because we wanted to make sure the samples were not contaminated. And the fact that we didn't get more positives in some of those high touch public areas, we're talking public transit, the door handles to popular coffee shops, places that hundreds, if not thousands of people touch, those all came back negative. So that was reassuring. I want people to know, look, with the coronavirus, if you are worried or paranoid that it's lurking everywhere, that's not really the case. But it was alarming to see that 20% of our samples in Miami did come back positive. That really is on par with the fact that we're seeing it's a hot spot there. And you're talking about a restaurant tablecloth, an ATM, an elevator button, and a garbage chute. So what does that tell you when you get a positive result? You don't know if it's infectious, but what you do know is someone who was sick, who was shedding the virus, was in that area. And that also, it's not being cleaned well enough to remove the virus. So it is really valuable information in context. And we should reiterate, this is not a scientific study. It's not a scientific experiment. Right. This was a small sample, but we went to 5 states and we took about 100 samples. So it's a good snapshot of what this test can do.
Let me tell you, Vicki, this morning I was just thinking maybe I'm going to get up the courage and I'm going to start going back to the grocery store and stop sending my husband. I saw that bread and I saw the handle of that cart and I said, nope, he can keep going. I'm going to stay home. Let me ask you this. You were able to swab those surfaces and see that evidence. If someone used this on themselves, on their bodies, would you be able to get a result too?
You know, that's a really good question. I have one of the swabs right here, and it's really, these are not designed for human use. So I really want to be sure that we are cautioning people. This environmental surface testing, while it uses PCR technology, and it may look like the swabs that are going into people's nasal cavities, it is not designed for human use. But what I can tell you is, look, let's say you live in an apartment with just a roommate or by yourself, and neither of you has been in or out too often, or you haven't had people in there. If you were to swab some of the surfaces like a mirror or places that you might not normally wipe down, if that came back positive for coronavirus, that would tell you someone who was sick has been in your apartment. It could be you, and you may have been asymptomatic. So that's what this kind of environmental surface testing can be used for in a school, in an office, in a big indoor space where you can't possibly clean every surface and you have a lot of workers or students coming in and out. It gives you an idea. We're sick people here. Are we seeing a spike in cases? Could this be the start of a potential outbreak? But no, you should not buy this to use on yourself. You should go to your county health department or your doctor to get an actual PCR test designed for humans. And by the way, these aren't cheap. A pack of 10 costs $400.
Oh, wow, not cheap at all. I was just thinking, oh, I'd love to swab my house. Might pass on that one. Vicki, again, thank you so much. You went to so many places that I'm sure people cringed when they saw you going in there. I know you had a mask and gloves, but thanks for being brave and thanks for the great reporting.
Of course, and a lot of hand washing. Always wear your mask. Honestly, that is what's going to be all of our best defense.
So important, Vicki. Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.